Did you know that faulty BP machine can give you a normal BP numbers when your BP is dangerously elevated, and it could be extremely fatal for you. It's not that it happens quite infrequently, it happens quite frequently. Today's video I will tell you as how to choose a proper blood pressure monitoring recorder at home so that you can have an adequate blood pressure recording at home. As a practicing cardiologist, I bring every week science-based practical tips for better health as well as cardiac health. So which blood pressure monitor should you choose for home blood pressure monitoring? There are various blood pressure monitors which are available, but the most prevalent and the most common which had been being used for a long time is Mercury Sphygmomanometer, and this is the gold standard where it is considered as one of the most accurate blood pressure monitoring. But it is nowadays being phased out in various countries because it has its own drawbacks. The most common drawback being the Mercury sphygmomanometer uses mercury, which could be toxic, especially if there are mercury spills, which can be toxic for health. And second, it is not user friendly. To have a proper blood pressure monitoring through a mercury based device, you require a stethoscope and you require a proper training. You have to be either a doctor or a nurse or a healthcare professional, and you need to be adequately trained to check BP through these mercury devices. So it is not user friendly for day-to-day practices for lay people. So although it is most accurate, it is the gold standard against all other BP monitoring devices are compared, but still it is not user friendly, especially for home based use. So what is the second blood pressure monitoring which could be used? These are Aneroid blood pressure monitoring. And these Aneroid blood pressure monitors, they do not use mercury. So they do not have the same drawback as that of mercury sphygmomanometer. It uses a dial and a pin method. So the advantage is that it doesn't contain mercury. Another advantage is that it is not bulky device, unlike that of mercury sphygmomanometer. But the disadvantage is that it requires a calibration and needs to be calibrated frequently against the mercury based devices. Another drawback is that it also requires training, because with this Aneroid sphygmomanometer, still you need to use the stethoscope. So either you need to be a healthcare professional or you need to be specially trained to assess the BP through these Aneroid devices. So these are the drawbacks of Aneroid devices. What about the third device? The third device through which we can check the BP are digital devices. And these digital devices are quite user friendly because you do not require a specific training for that. Anybody and everybody can check this. Even an old person, senior citizen also can check it at home. So that's why they are very commonly used, especially in home setting, where we do not get an expertise always. You do not get always a doctor or a healthcare professional to check your BP at home. So for self-measurement of BP, digital monitorings are most commonly used. So these are three types of digital monitors. One is which you can put on your arm, another digital monitor, wrist-based digital monitor, and third digital monitor is finger-based. Out of this wrist-based and finger-based digital monitors and arm monitors are the most accurate. So if you want to choose a device, a digital device, it's better to choose a digital device which uses the arm-based method of checking the blood pressure rather than a finger-based or wrist-based method. So it is most user-friendly. These are the advantages. And it is not bulky. You can store the readings. These are all the advantages. So what are the disadvantages? Disadvantages are that it quality varies from model to model. So you have to know which model to choose from. And wrist, as I have discussed, the wrist and finger-based digital monitors are less accurate compared to arm-based. Another important disadvantage is that it can be quite erroneous, especially if the patient is moving or if there is an irregular heart rate. In all those conditions, it could be erroneous. So especially in case of irregular heartbeat, few patients, especially our senior citizens, they tend to have irregular heart rate because of atrial fibrillation or multiple ectopics when the heart rate is bit irregular. And in this irregular heart rate, the digital monitoring could be quite inaccurate. So in case of irregular heart rate, it is better to go for a manual BP measurement through either Mercury or Aneroid variety. There are specific digital monitors also which are specifically designed for irregular heart rate monitor. But as such, the digital monitors are inaccurate if somebody is having an irregular heart rate. So if you are having an irregular heart rate and your digital monitors are not showing a blood pressure, you need not be frightened because they are most of the time inaccurate when there are irregular heart rate. So you should ensure a proper blood pressure recording through a digital monitor, and we have already discussed how to assess, how to do a proper blood pressure monitoring at home. For that you can refer to our prior video where we have discussed as how to check a proper blood pressure monitoring at home. But the most important thing when choosing a BP monitor, especially a digital monitor, is to look for validation, because all brands are not the same. There are quite a few brands in the market which are cheaper, but they are not validated by various validating agencies, especially few validating agencies like ISO certification or AMI certification, AAMI. AMI stands for the Device Manufacturing Institutions, Medical Device Manufacturing Institutions, or ESH certification. ESH stands for European Society of Hypertension. So either ISO certified or ESH certified or AAMI certified. If these certifications are there, out of these three, at least one certification is there for that particular brand, then you can go for, because there are lots of digital monitors in the market which doesn't have a certification, and these uncertified devices may not give a correct blood pressure monitoring. And you should always calibrate these digital monitors with a clinic based Mercury monitors, because as I have discussed previously, the Mercury monitors are the most accurate. So digital monitors need to be calibrated against the Mercury monitor at least six monthly. So if you have a digital monitor, check the digital monitor, what is your blood pressure at home, bring it to your doctor's office and check the blood pressure in the doctor's office with a Mercury based device. And if both of them are correlating around within plus minus 5, that means your digital monitor is working. So digital monitors needs to be correlated with your clinic blood pressure monitoring, that is the Mercury one, every 6 monthly. And Aneroid, the dial and pin type of BP monitoring, that needs to be validated against the Sphygmomanometer every 1 year. So if you like our content, kindly like and subscribe to our channel. So there are few brands especially we can choose, especially brands like Omron or Microlife or Welchulin. These are good companies which are having a certification, as we have discussed, either ISO certification or AAMI certification or ESH certification. And few specific brands like Omron HEM 7124 or Omron HEM 7156 or Omron HEM 7163. These are the few important user-friendly digital devices which we can use at home. So ultimately the final recommendation would be you can use a digital monitoring at home, because using a Mercury based monitor at home might not be suitable, but look for validation. Check whether all these certifications are there or not, and you need to calibrate this with the clinic Mercury machine every 6 monthly. Do not go for a cheap alternative options of a digital monitor which are available in the market, because these cheap uncertified devices may not give you a correct BP monitoring. Because for your health, you should invest in your health, and blood pressure is very important aspect, because blood pressure, hypertension is a silent killer. So you need to have a good BP monitoring device at home. Even if it is a digital, go for a good BP monitoring device. Especially I have found this Omron device is very user friendly. This is Omron HEM 7600T. This is quite user friendly. With a click of a button, we can get a good reliable blood pressure monitoring. So best choice for home blood pressure monitoring is a digital one, and especially those who are certified by this certified agencies and check a digital monitor which is arm based rather than a wrist or finger based. So if you like our video, you can refer to our next video which we had spoken about what are the common mistakes which are being done while recording the BP at home. And thank you all for your patience.